What exactly are these side effects? That is exactly what I'm going to be telling you about in this video. So please, if this is your first time of coming here, click on the subscription button and turn on your notification. Let us grow together in this channel. Thank you once again for coming to this channel. Hello kings and queens, you're welcome to this channel. This is Emanuela, and if this is your first time of ever coming to watch my videos, you're welcome. Please click on the subscription button and turn on your notification for those videos. And if you have been to this channel before, thank you so much for always following me in this channel. Again, please tell your friends about this channel. Quickly today, we are going to be talking about the side effects of taking in painkillers, or the various side effects of taking in excessive painkillers. I am going to be giving you the reasons why you should avoid self-medication as much as possible. Yes, please, I'll be giving you lots of reasons why you should avoid self-medication as much as possible. And I do hope that by the end of this video, you're going to learn a lot and you're going to apply all that you're going to learn from this video. So quickly, let's get into what we have today. Once again, thank you so much for being on this channel. I am Emanuela by name, and today I'm going to be talking about the side effects of taking in painkillers or the side effects of self-medication. For example, if I take in painkiller like aspirin contains what we call acetyl-CoA, and this acetyl-CoA is going to bind on what we call serine. Serine is found on cyclooxygenases that help in the production of prostaglandins from arachidonic acid. Now, the functions of prostaglandins is what will help us in this channel to analyze the various side effects of taking in painkillers, because the concept of painkiller is actually to inhibit the production of this prostaglandin, because when it binds to the serine, prostaglandins will not be able to form. Now, what are these functions of prostaglandins? There are thousands of functions of prostaglandins, but in this video I am going to limit it as much as possible to what we need, so that we will not spend the whole day watching this video. Even though I know you are going to please watch to the end, because you are going to learn a lot, and by the end of this video you are going to give me reasons on the comment section on why actually you should stop self-medication, or why actually you should stop the abuse of painkillers. Okay, let's get into what we have today. Naturally, these prostaglandins are the mediators of inflammation, and they determine the duration and the intensity of pain and fever. For example, when I'm having fever, prostaglandins have been released in order to make I can say so, like I've been having fever for like 3 days, I've been having fever for like 4 days. Most times prostaglandins are behind this. Behind every fever or pain are prostaglandins, and that is why painkillers attack them. Naturally, what do you expect? Painkillers will naturally attack them, because painkillers are taken to reduce what they are causing. However, there are side effects, because these prostaglandins help, for example, during childbirth. When a woman is in labor, for example, these prostaglandins are released, and the release of this prostaglandin enhances uterine contraction, and this uterine contraction helps in the propulsion of the baby through the mammalian canal. So predominantly it helps in reproduction and enhances childbirth. There are also other functions of prostaglandins. For example, for those that have peptic ulcer, prostaglandin inhibits the secretion of prostaglandin helps in the inhibition of peptic secretion, gastrin, for example, and then gastric HCl, that hydrochloric acid. And you know that when these things are secreted, it worsens the ulcer. Why? Because it increases ulceration, and when it increases ulceration, it also leads to bleeding and some other gastric irritation. These are the functions of the prostaglandin. Prostaglandin helps in order to inhibit this gastric secretion for those that have peptic ulcer. There are also other functions of prostaglandin. However, for those that have peptic ulcer, I also want to add this as a side note. When it inhibits it, it can also lead to an increase in secretion of the things that are secreted by the pancreas, leading to diarrhea, because intestinal motility will be increased. That is what the movement of the intestine in a layman's language will be increased, and this leads to diarrhea. So the increase in intestinal motility is actually what leads to diarrhea. This is one other side. So when you have diarrhea and you have peptic ulcer, it's all for good. I just want to tell you that when you have diarrhea and you have peptic ulcer, it's all for good. Now let's go into more. What again is the function of this prostaglandin? Prostaglandin, for example, when you have a wound, it helps in the healing of wound because it causes inflammation. Inflammation is actually an advantage, because when there's swelling, where there's redness and all, it's because the place is healing. So prostaglandin is very important. Okay, now this leads us to the side effects of taking in painkillers, because when you're taking painkillers, these prostaglandins will not be secreted again, and when these prostaglandins are not secreted again, there are many things that happen. Which number one, there will be ulceration. and there could be excessive bleeding, and this could lead to death. Now take note. Please take note of this. Please take note. I'm not saying you should not take painkillers at all. What I'm just saying is that you should consult your doctor or an expert when you want to take painkillers, and you should, as much as possible, avoid self-medication. I have a friend that can take a particular painkiller, I don't want to mention it, for like 3 times a day or even 4 times a day. I can even take like 4 tablets at once. These things are actually like it's cause for concern, and that's why I am making this video. Please, as much as possible, avoid the excessive intake of painkillers, and as much as possible, consult your doctor. Only take painkillers. Only take painkillers when the doctor or an expert has advised you to. Now, just on a side note, prostaglandins, actually from the name prostaglandins, they are named prostaglandins because they were first discovered from the prostate gland. This is a reason why it is named prostaglandin, but that is by the way. So please, I hope this video has really helped you. If truly it has really helped you, I know, please let me know on the comment section. And then again, please share it with your friends, share it with your family members, so that we all can avoid the excessive intake of painkillers. Please talk to your doctor as well to avoid the excessive intake of painkillers. Thank you so much for watching. Subscribe, click on the subscription button to know your notification so we can grow together. Bye bye.